Joining me in the studio is Dr. Darren Traub. He's the Medical Director of Cardiac Electrophysiology at St. Luke's University Health Network. Dr. Traub, thanks for being here.
It's my pleasure.
So we hear a lot about irregular heartbeats, but what exactly differentiates an irregular heartbeat with actually being diagnosed with AFib? Can you explain that to us a little bit?
Sure. When people complain of irregular heartbeats, that can mean a myriad of things. It could be extra beats from the bottom chamber of the heart, extra beats from the top chamber of the heart. Actual atrial fibrillation is when your heartbeat is irregular all the time. In other words, you're stuck in a situation where you've lost atrial contraction and actual atrial firing from the top chamber of the heart, and it's just basically a chaotic, irregular rhythm all of the time.
What are some of the symptoms that people might need to pay more attention to know that they need to get medical attention? So, of course, that sensation of the irregular heartbeat, but is there anything else that would be a warning sign or something people might brush off that they really should get checked out?
Any change in your exercise tolerance can be a sign of a heart problem, but it can also be a sign of a rhythm disturbance. For instance, that can cause you to not be able to go upstairs as efficiently, not be able to walk. You know, if you were able to do 3 miles and suddenly you're struggling to do 1 mile, that is a situation where it can be certainly a sign of a blockage or a sign that the heart is weakening, but it can also be a sign that you're having a rhythm disturbance and you've lost your heart's efficiency.
When someone comes in and sees you or one of your colleagues and they get diagnosed with AFib, I think that we often think, or I certainly do, about a pacemaker being the option. What are some treatment options and when does a pacemaker come into play?
That is a wonderful question because patients ask me all the time, can I just have a pacemaker to take care of this? And the answer is a pacemaker can help in the treatment of atrial fibrillation, but a pacemaker does not cure atrial fibrillation. So controlling the symptoms may be simply just putting them on drugs to slow the heart rate down, or it could be putting them on drugs that keep them in regular rhythm. We call those antiarrhythmic drugs, and they're a little step up from the standard rate-slowing drugs like beta blockers or calcium channel blockers. And then if we can't get where we need to be with those two options, then we start talking about a catheter ablation like Patrick had, where we go in and try to eliminate the signals causing the atrial fibrillation, or maybe we put a pacemaker in because a pacemaker will set a bottom rate for the heartbeat, say 60 beats a minute, and then we can sort of pile on all the drugs we need to treat the atrial fibrillation and control the symptoms.
It seems like it's a very customized, personalized plan for each patient, but I think it's very comforting to know that there are a lot of options that are not surgical in nature that can help patients.
Yeah, I would say about 20 to 30% of patients end up needing an ablation or a pacemaker. It's actually the majority can be controlled simply with medications.
What is your approach to patient care? What's most important to you as their physician?
Most important to me is that, number one, they know I'll be there for them. So when I meet my patient, I want them to know, you've chosen me as your doctor, and that means I'm going to make myself available to you, and I'm going to make sure that you understand what's going on with your heart, that you feel comfortable with it, and that we can move forward together as a team, me and the patient. And if I can make them or help them understand the process of their heart disease, then together we can move forward and we can make them comfortable with it. And the majority of patients do really well, and I love seeing them in the office every 6 months to a year and hearing about their families and how well they're doing. And if they have new symptoms, then we address them and fix them.
Well, Dr. Traub, it's wonderful to see. We were fortunate enough to spend time with you and your colleagues, and you're all very well loved, and the care that you give to your patients really is outstanding. So thank you for being here with us today.
Thank you for having me.
For more information on St. Luke's cardiac care or anything from today's show, go to our website at thepeaktv.com. Thanks for joining us, and remember, every day is an opportunity to be your best self. This is The Peak.